Galloping prevalence of type 2 diabetes in India is a matter of big concern. And when we look at the number of diabetics that we have today, which has crossed almost 100 million, and another 136 million pre-diabetics, it is incumbent upon us to understand this disease properly and devise all the possible strategies to mitigate the complications related with diabetes. It's absolutely no-brainer to understand that if we leave diabetes untreated, it's going to end up in huge burden of microvascular and macrovascular complications. And the unfortunate thing today is the quality of good glycemic control is abysmally poor in India. Almost 20% of the patients hardly get a good glycemic control to the target and remain uncontrolled. And this trend is quite alarming because it's already very expensive to treat diabetes. And if we are going to treat the huge burden of complications, that will be a disaster. And then we can easily identify that what are the unmet needs in the management of diabetes. And I think one of the important issues is the procrastination. We keep using one drug and then another drug and so on and so forth. And this incremental approach to treatment never gets the patient to the target, and that's why it sets up the stage for development of long-term complications. And therefore, we should be using combination therapy much early in the natural history of type 2 diabetes. And we know for sure that there are some molecules today like DPP4 inhibitors and SGLT2 inhibitors and GLP-1 receptor agonists which have completely revolutionized the management of type 2 diabetes, because we know the benefits of incretin treatment. They increase the insulin secretion in a glucose-dependent manner. They suppress the glucagon secretion in a glucose-dependent manner, give you adequate amount of insulin for good glycemic control. And the beauty is that they do not cause hypoglycemia and they do not lead to weight gain. They are also neutral to the cardiovascular system. And all these benefits of incretin actually lead to a great advantage for the patients. Similarly, when we look at the SGLT2 inhibitors, they have a unique mode of action because they inhibit the renal reabsorption of glucose, thereby leading to glycosuria, which not only controls the blood sugar, but also leads to calorie loss, and that in turn leads to weight loss, which is extremely beneficial for patients of type 2 diabetes. At the same time, because of the number of putative mechanism of actions of SGLT2 inhibitor, it leads to cardio-renal protection, which have been shown in number of trials. And we have seen huge amount of data coming with molecules like dapagliflozin that it leads to reduction in the heart failure hospitalization and a very huge impact in preventing the progression of chronic kidney complication. All these things are extremely important for a patient of type 2 diabetes, and in fact the data continues to grow beyond patients of diabetes. Now, even in non-diabetic patients of heart failure and chronic kidney disease, there is sufficient data to reinforce the use of SGLT2 inhibitor into clinical practice. And obviously, it sounds logical that if you have two versatile molecules at your disposal and combination therapy is important to start much early in the natural history, then dapagliflozin and molecules like DPP4 inhibitor should be combined into one molecule that will give the ease of administration to the patient and will address all the core pathophysiological defects of type 2 diabetes. As we can see here, there are a number of mechanism of action. DPP4 inhibitors practically target 5 or 6 pathophysiological mechanisms, and SGLT2 inhibitor prevents the renal reabsorption of glucose, and both these combined together address most of the pathophysiological mechanisms. And obviously, the core defects, which was very nicely enunciated by Ralph DiFronzo in his Banting lecture, you can see here that this combination will address almost all the core defects in type 2 diabetes mellitus, as you can see here. And therefore, when we come back to our patients of type 2 diabetes in India, I think we know for sure that we have a double whammy of persistence, insulin resistance, and a poor insulin secretory capacity. And when we combine this kind of molecule, it will address both the issues. And one benefit that accrues by using this sort of combination that we know that there is an increased risk of genital urinary tract infection in patients who are using SGLT2 inhibitor. And we know that if you combine SGLT2 inhibitor with a DPP4 inhibitor, it mitigates the risk of genitourinary tract infection. And that's why this combination is extremely beneficial. And this beneficial effect is not only limited to this, but also we know that this combination will give you cardiovascular benefits, renal benefits, and that is the reason most of the newer guidelines actually talk about using this combination of molecules much early. Another important component of glycemic control today is glycemic variability. We should not be using molecules which lead to upswing and downswing in the blood sugar level. And if we have molecules which do not lead to a lot of glycemic variability, then it actually gives us a lot of confidence. And therefore, I would like to summarize that type 2 diabetes being a chronic progressive disease, it is important that we hit early and hit hard, and a proper combination of oral anti-diabetic agents should be used. And in that context, a DPP4 inhibitor and an SGLT2 inhibitor combination is extremely important, because it will not only provide good glycemic control, but will avoid weight gain, will not lead to hypoglycemia, and certainly produce cardio-renal benefits.